I'm running to be the president of the Canadian Medical Association because this role matters. Notre système de santé est sous pression. On se bat à tous les jours contre la désinformation et le climat devient instable. When we take physicians who are a trusted voice, a national network well connected into the Canadian Medical Association, and combine that with the Canadian Medical Association's ability to plan for both short and long-term horizons, we can help Canadians make a plan that will keep them healthy now and into the future. That's important leadership. There's no one else in the Canadian spectrum that can do it. I want to be part of that leadership. Ça fait maintenant 14 ans que je travaille comme médecin urgentiste à Yellowknife. I know what it's like to just try to keep the doors of the emergency department open in the face of workforce shortages and strain, at the same time as you're worrying about upstreet drivers of ill health like climate change. So I've actually helped to co-create and build some of the fundamental organizations in the space, both in Canada and nationally. Through that, kind of by trial and error, and also with some training at Harvard and Oxford, I've gotten a lot better at public policy, advocacy, and communications. The CMA is Canada's most powerful advocacy organization. It was the top lobbyist last year in Ottawa, and I know that I can bring the skills that I've learned about how to drive evidence-based, ethics-driven, power-informed change that I've learned through my work in the Northwest Territories and abroad to the work of the CMA and furthering a healthy future for all of us. From work I've done in the past, I know that relationships are key to change. I come into this role with a really strong network of relationships locally, nationally, and internationally from the work I've done at the intersection of the health of people and planet. And I look forward to taking some of that more strongly into the healthcare system. I also know that people work better together when there's a really clear shared vision of where we're moving. The CMA has a strong Impact 2040 strategic plan that makes clear not only what our short-term goals are, but our long-term goals. And I think the more we rally people around a common vision of long-term well-being for all, the more we'll be able to steward those relationships and make really concrete progress moving forward. Peu importe où je suis, tout le monde veut la même chose. Se sentir bien, puis savoir que sa famille va être en sécurité maintenant et dans l'avenir. If I can leave my term as CMA president knowing that patients, doctors, and decision makers all understand that the ecological foundation is absolutely central to our ability to build, staff, and supply the healthcare systems that patients depend on, I will leave and be able to take a sigh of relief knowing that all of those smart eyes are on that foundation and are working to provide a stable healthcare system for present and future generations.